Welcome to the presentation, Understanding Medicare, Going Through the Basics. This presentation will be presented by Dr. Julian Azuzzi, PharmD, Health Disparities and Outcomes Research Fellow at Carroll College of Pharmacy, Dr. Kimberly Clark, Community-Based PGY1 Pharmacy Resident with Nuvance Health, and Dr. Shabnam Manwari, Safety Net Health Equity Fellow, the APHA, and Nova Scripts Central. Our goal is to promote health equity by increasing health literacy, improving understanding of the U.S. healthcare system, break down barriers to access, and providing resources for patients. The objectives of this presentation will be to explain or describe Medicare, Medicare Advantage, and dual eligible, identify the differences between Medicare Part A, Part B, Part C, and Part D, and review how individuals can sign up for Medicare. Before we begin, please take this pretest.
Medicaid and Medicare are two different programs. Medicaid is a state-run program that provides hospital and medical coverage for people with a lower level of income. Each state has its own rules about who's eligible and what Medicaid covers. Some people qualify for both Medicare and Medicaid. For more information about the Medicaid program, contact your local medical assistance agency, social services office, or get state contact information at www.medicaid.gov. What is Medicare? Medicare is a federal health insurance program for people aged 65 or older. People younger than age 65 with certain disabilities, permanent kidney failure, or amyotrophic lateral sclerosis, ALS, also known as Lou Gehrig's disease, can also qualify for Medicare.
Medicare is broken into four main parts: Part A, Part B, Part C, and Part D. Medicare Part A and Part B may also be referred to as Original Medicare. Medicare does not pay for all healthcare costs. Medicare helps pay for healthcare. It does not include coverage of all medical expenses or the cost of most long-term care. You have different choices for how you get Medicare coverage to help pay for your healthcare. Medicare Part A helps pay for hospital, skilled nursing facilities, hospice, and home health care. Medicare Part B helps pay for medical care such as clinic visits, lab tests, surgery, medical equipment, preventative exams, disease screenings, and other outpatient and home health care. Medicare Part D helps pay for prescriptions and medications. Each Medicare Part D plan covers medications differently, so your most affordable drug plan is unique to you. This means that the plan that is best for you may be different than the plan that is best for your spouse or friend. There are multiple resources available to determine your most cost-effective drug plan, including the Medicare.gov website, your local pharmacy, or your local senior center. Give them a call for help finding your most affordable drug plan. Medicare Part C, also known as a Medicare Advantage plan, includes covered in Part A, Part B, and Part D, may also include eye, dental, hearing, and other coverage. A Medicare Part C plan administers the healthcare treatment of an enrollee utilizing a physician, otherwise known as a gatekeeper. This physician must approve the patient's referral to specialized care. However, some Medicare Part C plans permit patients to go directly to a specialized care provider without their physician's approval, in return for extra payment or a higher premium. A patient may choose to receive Medicare coverage and care through Part C plans by filling an enrollment form. Once this choice is made, the patient generally must receive all of their care through the plan in order to receive Medicare coverage. Beneficiaries can change their minds, disenroll from their Part C plan, and return to original Medicare. Part C plans are intended to offer options for the financing of Medicare-covered health services. The option includes coordinated care plans, which also includes managed care plans, as well as medical savings accounts, private fee-for-service plans, and other options.
The Centers for Medicare and Medicaid Services, also known as CMS, is the agency in charge of the Medicare program. However, in order to apply for Medicare, applications are processed through the Social Security Administration. So, the SSA processes your application for Original Medicare, which is Medicare Part A and Medicare Part B. But Social Security also provides general information about the Medicare program and can help you get a replacement card. So with that being said, it's so important to notify the Social Security Administration if there's any changes in your name or address or any deaths. Now, I know you're probably wondering, when can I sign up or when am I available to sign up for Medicare? So generally, you're first eligible to sign up for Medicare Part A and Part B starting 3 months before you turn 65, and this window ends 3 months after the month you turn 65. You can apply by clicking on the link provided or going to ssa.gov. So what happens if you don't enroll during that initial enrollment period and you enroll at a later time? So with late enrollment comes with late penalties. If you don't enroll in a Medicare plan when you're first eligible, you may pay a late enrollment penalty if you join a plan later. And unfortunately, you will have to pay this penalty for as long as you have Medicare coverage. However, you may not have to, or you won't have to pay if you have extra help or another creditable prescription drug plan. But to be creditable, the coverage must pay on average at least as much as Medicare's standard prescription coverage. So to explain, for Part A, if you have to buy Part A and you don't buy it when you're first eligible for Medicare, your monthly premium may go up to 10%, and you'll have to pay the penalty for twice the number of years you didn't sign up. For Part B, you'll pay an extra 10% each year you could have signed up for Part B but didn't. And you may also have a higher premium dependent on your income. And for Part D, which is prescription drug coverage, generally you won't have to pay a Part D penalty if you have creditable drug coverage, and that's coverage that's similar in value to Part D, or you qualify for extra help. And extra help is a Medicare program to help people with limited income and resources pay for Medicare drug coverage, premiums, deductibles, coinsurance, and other costs. But for Part D, if you don't sign up, you'll pay an extra 1% each month, which is 12% a year if you don't join a Medicare drug plan when you first get Medicare. And you may also pay a higher premium dependent on your income. But after you join a Medicare drug plan, the plan will tell you if you have to pay a penalty and what your premium will actually be.
Once again, Medicare Part A is our hospital insurance. In order to qualify, you would need to be 65 years old as well as a citizen or permanent resident. There are 3 situations that would make Medicare Part A have no cost for someone aged 65. 1. You get benefits from Social Security or railroad retirement. You or your spouse worked long enough in a government job through which you paid Medicare taxes. Or 3. You are the dependent parent of a fully insured deceased child. If you do not meet these requirements, you may be able to get Medicare Part A by paying a monthly premium. Usually, you can purchase this coverage only during designated enrollment periods. Now, I wanted to provide more clarification on what a dependent parent of a fully insured deceased child means. In order for a parent to be able to claim a benefit on the work record of their child, including a stepchild and adoptive child in some cases. The child must be deceased and have had sufficient Social Security work credits to be considered fully insured. The parent must be at least age 62. The parent must not have gotten married since their child has died, though it is okay if the parent was married at the time of death and is still married. The parent must not be entitled to a retirement benefit that is greater than or equal to their benefit as a parent. And lastly, the deceased child must have been contributing at least 50% of the parent's support. If you are younger than 65, the following reasons would qualify you for Medicare Part A at no cost. 1. You've had Social Security Disability Insurance, also known as SSDI, benefits for 24 months. 2. You receive a disability pension from the RRB and meet certain conditions. 3. You receive SSDI benefits because you have ALS. 4. You have worked long enough in a government job through which you paid Medicare taxes and have met the requirements of the SSDI program for 24 months. Or 5. You're the child or surviving spouse age 50 or older, including divorced surviving spouse, of a worker who has worked long enough under Social Security or in a Medicare-covered government job, and you meet the requirements of the SSDI program. Qualification for someone younger than 65 who would qualify for Medicare Part A at no cost is if someone has kidney failure and is on dialysis, or kidney transplant and one of the following. They've worked 10 years paying Social Security or Railroad Retirement System, RRS, worked 10 years in a Medicare-covered government job, or is the child or spouse, including a divorced spouse, of a worker living or deceased who has worked 10 years paying Social Security or in a Medicare-covered government job.
Medicare Part B is medical insurance. Part B is a voluntary program that requires the payment of a monthly premium for all parts of its coverage. Eligibility rules for Part B depend on whether or not you're eligible for a premium-free Part A or whether or not you have to pay a premium for Part A coverage. So anyone who's eligible for Part A at no cost can enroll in Medicare Part B by simply paying a monthly premium. For those who have higher incomes, will pay a higher monthly Part B premium. You can also click on the inserted link for more information on rules for higher income beneficiaries. If you're not eligible for Part A at no cost, you can buy Part B without having to buy Part A, but you must qualify by being 65 years of age or older and have at least one of the following, which would be either you're a U.S. citizen or you're a lawfully admitted U.S. citizen, meaning you have lived in the U.S. for at least 5 years. And it's important to keep in mind you can only sign up for Part B during the designated enrollment periods. And if you don't enroll in Part B when you're first eligible for it, you may have to pay a late enrollment penalty for as long as you have Part B coverage. Medicare drug coverage, which is Part D, helps pay for prescription drugs that you need. It is optional and offered to everyone with Medicare. So even if you don't take prescription drugs now, it is still important to consider getting Medicare drug coverage. So anyone who has the original Medicare, which is Part A or Part B, is eligible for Medicare prescription drug coverage, Part D. So Part D benefits are available as a standalone plan or built into Medicare Advantage unless you have a Medicare private fee-for-service plan. But the Part D benefits work the same way in either plan, whether you have Medicare Advantage or the Medicare private fee-for-service plan. So again, joining a prescription drug plan is voluntary. However, you will have to pay a monthly premium for the coverage. Some individuals with higher incomes will ultimately have to pay a higher monthly premium. But for more information on rules for higher income beneficiaries, please click on the link provided.
Moving on to American Indian, Alaska Natives, and Medicare. There are special rules for Center of Medicare and Medicaid Services, also called CMS, when working with Indian Health Service, tribes, and urban Indian programs. I'm not going to go into depth about this, but I have provided a link to learn more. You can click on the box where you see the finger pointing. I've also provided a video if you'd like to learn more about the role of CMS in Indian health.
Dual eligible refers to those who qualify for both Medicare and Medicaid benefits. dual-eligible beneficiaries receive health coverage from both the federal and state government. Medicaid also covers additional services beyond those provided under Medicare, including nursing facility care beyond the 100-day limit or skilled nursing facility care that Medicare covers, prescription drugs, eyeglasses, and hearing aids. Individuals who are dual eligible are automatically enrolled in a Medicare drug plan, and if partially dual eligible, may qualify for a Medicare savings program. Being dual eligible is helpful as it lowers healthcare costs, as services covered by both programs are first paid by Medicare, then Medicaid filling in the difference up to the state's payment limit, and lowers monthly rates, as Medicare enrollees who have limited income and resources may get help paying for their premiums and out-of-pocket medical expenses from Medicaid. Being dual eligible also offers coordinated care and offers long-term care.
Medigap is sold by private insurance companies to fill in the gaps in the original Medicare Part A and Part B coverage. So individuals choose to purchase a Medigap policy to pay for some of the healthcare costs that Medicare doesn't, such as co-payments, for instance. Social Security will enroll you in the original Medicare, and you must have Medicare Part A and Part B in order to buy a Medigap policy. So again, in order to be eligible for Medigap coverage, you'd have to be enrolled in Medicare Part A and Part B. However, you will still have to pay your monthly Medicare Part B premium. In addition, you will also have to pay a premium to the Medigap insurance company. And as long as you pay your premiums, your Medigap policy is guaranteed renewable. So this means that it is automatically renewed each year. And your coverage will continue year after year as long as you pay your premiums. Another thing, it's important to compare Medigap policies because costs can vary. So essentially, Medigap policies are standardized and insurance companies must provide the same benefits, but the only difference is essentially the cost. And some Medigap policies also cover other extra benefits that aren't covered by Medicare. But for more information, you could click on the link provided to start reading and comparing plans.
If you choose a Medicare Advantage plan, you can buy a Medicare-approved plan from a private company that bundles your Part A, Part B, and usually prescription drug coverage, known as Part D, into one plan. Medicare Advantage plans were previously known as Part C. This includes all benefits and services covered under Part A and Part B, plus prescription drugs, and may also carry additional benefits such as vision, hearing, and dental bundled together in one plan. If you decide to join a Medicare Advantage plan, you will use the insurance card that you get from your Medicare Advantage plan provider for your health care. Also, you may have to pay a monthly premium for your Medicare Advantage plan because of the extra benefits it offers. You can enroll in a Medicare Advantage plan during your initial enrollment period. You can also enroll during the annual Medicare open enrollment period from October 15th to December 7th each year. Different plans may be known as Health Maintenance Organization plans, Provider Organization plans, Private Fee-for-Service plans, and Special Needs plans.
So Medicare savings programs vary state by state, and you'll have to qualify to be eligible based on your state-specific criteria. So these programs are designed to help those with low incomes pay for the cost of Medicare. So if you're part of a Medicare savings program, some or all of your monthly Medicare premiums could be paid for by Medicare. And you can get help from your state paying for your Medicare Part A, which is your hospital insurance, and your Medicare Part B coverage, which is your medical insurance, and these premiums through a Medicare savings program. So if you qualify, The Medicare Savings Program might also pay for your Part A and Part B deductibles, coinsurance, and copayments. But essentially, you can reach out to your Medicare Savings Program with your state's Medicare office if you qualify. So that would be if you have or are eligible for Medicare Part A, you don't exceed the income requirements, and you don't exceed the maximum limited resource requirements that are defined by your state. So again, only your state can decide if you are qualified for help under these programs. So there are different types of the Medicare Savings Program. So essentially there are 4 different categories that do help offset some of the costs associated with Medicare. And dependent on your individual circumstances, you may qualify for one or more of the following programs. The Qualified Medicare Beneficiary Program helps pay for Medicare Part A and Part B premiums, deductibles, coinsurance, and copayments. In this program, you can't be billed for services and items Medicare covers except outpatient prescription drugs. The Specified Low-Income Medicare Beneficiary Program is a state program that helps pay for Part B premiums. Qualified Disabled and Working Individual Program covers Medicare Part A premiums only, and this is for individuals who have a disability, are working, and lost premium-free Medicare Part A and Social Security disability benefits. And if you qualify for one of the first 3 programs listed above, you automatically qualify to get extra help paying for Medicare prescription drug coverage. Lastly, the Qualified Individual Program is similar to the Specified Low-Income Beneficiary Program, but has a higher monthly income limit, and you must reapply for this program every year.
So, when should you enroll in Medicare? Fall open enrollment occurs each year from October 15 through December 7th. An application for Social Security or Railroad Retirement benefits will trigger automatic enrollment in both Medicare Part A and Part B. I wanted to note that Part B is voluntary and you do have the opportunity to decline enrollment. Any changes made during fall open enrollment would then take effect January 1st. Now, how can you enroll? There are 3 options: by phone, online, or in person. To sign up by phone, call 1-800-MEDICARE. Follow prompted menu options and enter identifying information. Make an appointment to schedule a call. Answer phone at scheduled appointment time. Mail deliver requested items to local Social Security office. To enroll online, apply online at the link provided on the slide. Apply for benefits Social Security at ssa.gov. Follow the listed instructions on the website. Mail deliver requested items to local Social Security office. In order to apply in person, identify a local security office. The link is attached to this slide for you to easily click on. Call 1-800-MEDICARE and make an appointment. I wanted to note this is optional. Bring necessary documents and consult with an agent. After you enroll in Medicare, you'll receive a red, white, and blue Medicare card showing whether you have Part A, Part B, or both. Keep your card in a safe place so you'll have it when you need it. If your card is lost or stolen, you can request a replacement card online by setting up a personal My Social Security account at www.ssa.gov/myaccount or call the toll-free number at 1-800-772-1213. You'll also receive Medicare and You, a handbook that describes your Medicare benefits and plan choices. There are several options when it comes to coverage and premiums. Therefore, it can be difficult to decide which one would be best for you. Medicare.gov shows you all of your choices and helps you compare them. You can also enter prescription drugs that you take to get an estimate of your monthly and yearly cost for each plan. On the right, I have an example of what the comparison looks like. You can see how it breaks down coverage and cost. An important topic I wanted to review is Medicare fraud and abuse. What is Medicare fraud and abuse? This would be billing for services that were not provided, provider billing for supplies that were not received, or a person who steals your Medicare number or card and uses it to submit fraudulent claims in your name. It is important to be aware of all of these situations so that we can prevent it. Medicare loses an estimated $60 billion each year due to fraud, errors, and abuse. So, what can you do? Protect your Medicare number and Social Security number. Guard your Medicare card. Read Medicare's privacy practices to better understand how your information may be used. And if you believe you did experience provider fraud or abuse, you can call 1-800-MEDICARE. That's 1-800-633-4227. Do not give your Medicare card, Medicare number, Social Security card, or Social Security number to anyone except your doctor or people you know should have it. Do not accept offers for free medical care. Do not allow anyone except your doctor or other Medicare providers to review your medical records or recommend services. And do not join a Medicare health or drug plan over the phone.
So there are a number of different Medicare resources that help explain the different parts of Medicare. It's great to use it to understand how Medicare may cover your healthcare services and medications. So one of the best resources to utilize is to go to the direct source of information, which is through the Centers for Medicare and Medicaid Services on cms.gov. The website provides information about Medicare coverage, Medicare health plans, and quality initiatives and free publications. So it's great to go through the website and read more information to have a better understanding of Medicare. The Patient Resource Center, you're able to learn more about Medicare eligibility requirements, coverage options, and costs specifically for immigrant populations. There are also links to written resources available in different languages as well. The Patient Advocate Foundation has a plethora of information such as definitions and explanations of Medicare's glossary of terms to help aid in that understanding. There's charts that explain the difference between Medicare plans and a step-by-step guide that can aid in choosing a Medicare plan as well. There's also a My Healthcare Tracker that's available for free, and it's a fraud fighting tool that's available for beneficiaries through the Senior Medicaid Patrol program. The trackers help prevent, detect, and report suspected Medicare fraud, errors, or abuse. So you're able to record your healthcare products. There's also instructions on how to compare the healthcare services, tests, and your medical equipment items that are documented in the tracker as to what is billed on your medical statements as well. And this can help reduce the amount that you may owe, and this can also help detect if medical identities have been stolen. And to get your free My Healthcare Tracker, you can contact your local SMP office as well. And to get more information on all of these resources, the links are provided as well. Coverage to Care is an initiative developed by the Centers for Medicare and Medicaid Services to help you understand health coverage and connect you to primary care and preventative services that are right for you so you can live a long and healthy life. Understanding your coverage can be overwhelming and confusing, so CMS has created this roadmap which explains what health coverage is and how to use it to get primary care and your preventative services. There are resources that are available in different languages, including Spanish, Arabic, Chinese, Haitian Creole, Korean, Russian, Vietnamese, and a tribal version. This resource is so helpful because it can help you understand what you're unsure of when you signed up for Medicare, how to use your coverage to get the care that you need, and where to go for answers.
Faith-based organizations can use the Medicaid Toolkit to share important Medicaid and CHIP information with those in their congregations, communities, and with those they serve. The toolkit includes ready-to-use resources such as bulletin inserts, key messages, social media messages, and more. Also check out the Center's public service announcement on Medicaid renewals to help spread the word about this current and critical issue for many in our communities. Myths versus facts. Myth 1. Medicare is only for U.S. citizens. However, this is not true. You do not need to be a U.S. citizen to qualify for Medicare. Requirements depend on whether you or your spouse worked in the United States and paid Medicare payroll taxes. If not, you'll have to pay premiums for coverage. Myth 2. You must be retired in order to get Medicare, which is false. Generally, Medicare is for those 65 years and older, have kidney failure, are disabled, or have ALS. Myth 3. Medicare covers all your medical expenses. However, this is false. Medicare Part A and B are not free. You may pay premiums, deductibles, co-pays, and co-insurance out of pocket, just like with any health insurance plan. Common questions you may have are, who do I need to contact to replace my Medicare card? And the answer would be to contact Social Security via telephone, email, letter, or by visiting a Social Security office. You may also wonder if you can have a Medigap policy and Medicare Advantage plan at the same time. The answer is no. Medicare Advantage plans cover many of the same benefits as a Medigap policy may cover. This includes benefits like extra days in the hospital after you've used the days that Medicare covers. And last, you may be wondering, do I have to re-enroll in Medicare every year? The answer is no. Once you're enrolled, you don't need to take action to renew your Medicare coverage every year. As long as you continue to pay any necessary Medicare premiums, your Medicare coverage should automatically renew every year.
I wanted to share a story from an article posted in MedPage today about the cost of not understanding your benefits so that you all are aware of the importance. There are disparities that Medicare recipients experience due to lack of understanding their benefits. A patient with Parkinson's disease was receiving the injection ustekinumab or Stelara for his Crohn's disease for the past 5 years. A licensed professional would administer the expensive injection at no cost to him. Stelara is an expensive medication costing around $40,000 per dose, but Medicare covered all the costs for him under Medicare Part B. On October 15, 2021, Medicare reclassified the drug to be a SAD drug or a self-administered drug and would no longer cover it if administered in the outpatient setting. The patient was unaware of this and so continued going to the clinic to have his injections administered. He did not know that every injection was costing him $43,543.47, which in 7 months added up to be around $176,000. The patient stated that Medicare claims he should have been aware that Part B does not cover most SAD drugs because these can be administered at home on your own. He was also told he should have read it in his Medicare and You handbook. Our goal is to avoid situations like this from occurring.
To summarize, Medicare is 4 parts. Part A helps pay for hospital, Part B helps pay for medical, Part D helps pay for prescription, and Part C, or Medicare Advantage, helps pay for hospital, medical, and prescription costs. Dual-eligible enrollees have both Medicare and Medicaid to help pay for healthcare costs. To enroll, call the 1-800-MEDICARE number, visit online at www.ssa.gov, or visit a Social Security office in person. Before we finish, please take this post-test. Thank you. If you have any questions, please feel free to contact us via email.